Welcome back to Coffee and Coverage. I'm your host, Nicole, and today we are joined by Marantz, who is our Medicare specialist and benefit consultant here at Pinnacle. Hello, Marantz.
Good morning.
Hi. Okay, so today we are going to continue our series on health savings accounts. This will be part 2, which is health savings accounts and Medicare. Make sure you check out part 1 of our HSA series previously. Okay, so let's talk about health savings accounts and Medicare, turning 65. So if you're turning 65 soon, we know Medicare can be confusing. There's a lot that goes on when it comes to that.
Yes.
But what if you also have a health savings account? Like you've already had one. What are some things you should think about changing coming up now that you're going on to Medicare?
Sure. So that's something that you're going to want to start planning. So if you're going to be going to Medicare, enrolling in any parts of Medicare, A, B, C, D, any of that, you can no longer have an HSA. You can no longer contribute. So that would start 6 months before you turn 65.
Okay.
There's a 6-month look back period. If you are not going to enroll in Medicare, you can't enroll in any parts at all, not A or anything.
Okay.
Then you can continue.
So if you were going to continue working, essentially, and not take out A or B or whatever. Okay.
Yep. Any parts, then you can still contribute to your HSA.
Okay.
And you still get that $1,000 catch up.
That's well.
For being 55 or older.
Okay. So let's say you no longer contribute, you turn 65 and you go on Medicare. What can you do with the funds that are in your health savings account? Like what happens now?
Sure. So after 65, you can pull those funds out penalty free.
Okay.
If you use them for something that's not a medical qualified medical expense, then that would be considered taxable income at that point. If you continue to use them for qualified medical expenses, then that's also tax free and penalty free.
And then I believe this is kind of a perk too, is you can use those funds for premiums now, right? Is that correct?
Yes.
For which kinds of premiums when it comes to Medicare?
That's from for your original Part A, Part B, and you can also use it for your Part D for prescription drug plan.
Okay.
And then for a Part C, which is a Medicare Advantage plan, and HMO though, has to be HMO.
Okay. So the funds don't go to waste, essentially, right? Like there's somewhere to put the money, and it's going to help pay premiums and or continue to pay for medical expenses. Sure. We just can no longer contribute 6 months prior. So make sure you're doing that up till then, and then kind of deplete the funds afterwards.
Yeah, that year you're going to be turning 65, or start planning kind of ahead, especially when you have an HSA.
Okay.
So that you're ready and you don't end up with a 20% penalty for contributing at any time.
Okay. And then I have one more question. What about if one spouse is turning 65 and the other spouse is not? How does that, do you know how that works contribution wise?
Yes. So if the other spouse is not, they would be able to open up their own HSA in their name. Okay. As if they're under 65. If you're working, let's say the employee is 65.
Okay.
The spouse is not. The employee can still contribute pre-tax dollars towards the spouse's HSA plan. That has to be in the spouse's name. Okay. The employer can no longer contribute for you if they were. Because the employee is now 65.
Okay.
No,
that makes sense.
Yeah.
So just to kind of recap, if you're married and one of the spouses is going to collect Medicare and move on with the Medicare world, essentially, and the other spouse is still under 65, you would just have to open a separate HSA for the under 65 spouse, and they can essentially business as usual when it comes to your health plan and HSA.
Yep.
And then the over 65 couple or spouse would move on to the Medicare and then deplete that HSA for their medical needs and premiums.
Okay. Use it. Yep.
Okay.
Absolutely.
Anything else that you want to add on that for this series?
I don't think so. I
Anything
know
else you can think
the
about?
Medicare world is a whole new ballgame for everybody, and then tying the HSA into it can
another factor.
Yep,
for sure. So, Okay, well, thank you for joining us today, Marantz, and helping to answer some questions. Be sure to tune in next month for part 3 of HSAs. And remember, coffee is optional, coverage is not.